All right. Well, thank you so much for joining us, Jim. We appreciate you taking time out of your busy day, and we're excited to talk with you about some of your experience and also some of your newer endeavors.
Great. Appreciate it, Tim. Thanks for having us on. Glad to be here.
Absolutely, absolutely. So your job is not an easy one. It's not easy to operate in the behavioral health space, especially not with a couple of different startups like you've done before. Would you mind giving us kind of your story of how you got into behavioral health?
Sure. Like a lot of people, for personal reasons, I had family members. I've been in the technology world probably since it started, so it's a long time. But about a decade ago, my immediate family went through some tough times, and several of my family members have struggled with what I would call severe mental illness along the way. And so it became kind of personal. So when I came across an opportunity to get involved in mental health care, I said, well, how hard can it be? um
Famous last words.
yeah, well, exactly what it was. So a lot of the hubris went away quickly, but it's for personal reasons, and there's a long way to go. It's I was shocked at how far behind behavioral health care is from even the rest of healthcare. It lags decades behind. So, but I got into it for those reasons, and I got to say I really enjoy being in it. Hey, the people you meet in it, particularly the people on the front lines, are there's a special place in heaven for them, I can promise you. And it's certainly not about money. It's all about just trying to help people. So anything we can do to help them, I'm all in.
Yeah, yeah. I've found the same. I enjoy working with the people in behavioral health more
Hmm.
than any industry that I've worked in, and which is one of the reasons among personal reasons that we're here too. So, what have you found is the hardest part of growing your team and your organization? Because I know Acuity Behavioral is fairly new.
Yeah, what you'd like to do, it's is you want to find, first of all, and I don't want to use the word character or values, but maybe more mission focused. Like
Mhm.
you said, find people who are in it. And yes, you want to build a successful business and you want to do all the things you need to do. But at the end of the day, there's a bit of a mission focus. Can we make things better? Can we do something that makes things better? So trying to get that alignment. And probably one of the great advantages of being an old fart is that you, across your network over many years in technology, have been fortunate to meet a lot of really great people who align with that. So our team today is, I'd like to call them tenured. Everyone's been around. Most of them are brilliant. You want to find people who are smarter than you, the old adage, and try to stay out of their way. And so I hope I do that and let them do their jobs. And they're extraordinary. So that's, to me, the hardest part is finding the people and matching up. Here's what we're trying to do. Are you on board with that, or only partially on board with that? And you want to find folks that are kind of all in on what you're doing. I've always believed that a small team of really focused people could outrun much larger teams with hundreds of people just because they were focused on it for the right reasons. It's kind of the old Marine analogy: you'd rather have a handful of them than platoons of those who were just showing up.
Yeah,
So I think a lot of that applies. And I think some of that is, and a maturity, and then certainly a technical depth and all the things you have to have. But, first and foremost, I think is, what are the people like? and
absolutely.
and do they align with what you and others want to do and where you're going? So that to me is the hardest thing. It's a little bit easier, as I said, when you get older, because you've been fortunate to meet a lot of good people along the way. But I'd say that's probably the most challenging thing. It's all about people, whether it's software, selling widgets, whatever you're doing. It's if you have good people, then good things happen.
Absolutely, absolutely. I have a favorite quote. I still don't know who said it first, but it's a famous CEO somewhere, and he said, "The best part about leading teams is people, and the worst part about leading teams is people."
People.
And
It's a great.
that's
It's
just how it
it's
goes.
I subscribe wholeheartedly to that. So that's
Absolutely,
yeah.
absolutely. So, how do you see AI shaping the future of psychiatric care, especially? Because I know that's something that you're deeply
Sure.
involved in.
I think it's fundamental. I think you'll be missing the plane, missing the boat if you don't implement or begin to implement. But it has to be done very thoughtfully. AI by itself, and we're in the clinical world. We serve inpatient psychiatry, emergency services. I mean, that's the world we're in. So it's really important that any technology you bring to bear there in a clinical environment, there has to be consistency to it. And one of the problems with Gen AI, for instance, is if I ask you the same question, I may get a slightly variable answer each time it comes back. And you can't have that variation. So one of the things we did at Acuity was we started building first and foremost what I call a thermometer, a measurement. And think of it this way. If you and I were building a deck on the outside of the house and you were in metrics and I was using inches and yards, it wouldn't look very good. And unfortunately, in behavioral healthcare, that's the way clinical operations are generally run around the globe. Everyone has done it differently because there aren't the standards or models that exist in the rest of healthcare. So the first idea is, can we create a standard way to measure it? Think of it as a thermometer on a scale of 1 to 100. And it's a deterministic model, which means if I feed it the same variables, it will always return the same output.
Yeah.
So once I establish that and validate that, then I can begin to use the deep analytics and the generative AI capabilities and all the data that you're accumulating and correlate it to that. I've got a foundation that I can build off it. So the answers aren't varying. The answers are coming back and they're relying on data that's consistent across the board. So it makes it a very different thing. So it's more complicated than, to say, can you help me on some marketing information or pull some stuff? I do believe fundamentally, though, it changes. We have a AI agent we call Nora, a nurse operations research assistant, and it's a natural language interface. And a nurse manager can type that in, and they do. And it has the ability, AI has the ability to go out and grab all this data at scale and return it and give information and insights that these people would take days, weeks, months, or could never find at all. So I think its role is in that kind of inform and suggest or help these people make better clinical decisions, not to make clinical decisions. I think, I do not subscribe to that. This is, if you give me more information about the patient or about the unit or about the health system and what's going on, then I'll make a better clinical decision out of that.
Yeah.
So that to me is a place, but I think it's fundamental. I think it's a cornerstone of psychiatric care that is oversubscribed, understaffed, and underfunded, and will be for as long as I'm alive. So we have to do things better. And I think that's where technology and AI can play a magnificent role, but not making the decisions, but getting the information to help those decisions from clinicians who need to make them be better decisions.
Absolutely. Absolutely. I think that makes perfect sense. I think a lot of people are talking about AI and how it's going to create so much more efficiencies and make organizations more efficient and more effective and make professionals more efficient and effective. When I think about industries that desperately need more work output with the same amount of staff and the same amount of funding input, I think behavioral health is probably the most desperate for innovation.
And the other thing it really does too is think about the most valuable thing you have when you don't have enough people and you have too many patients showing. It's your time.
Yep.
So if I can save you time as a clinician, if I can give you more time to do the things that you need to be doing, that's where I think it can play a critical role. A lot of the mundane tasks, pulling information, developing certain things on the side that I can read so I don't have to hunt them down myself. That I think is a spectacular use of it, and it needs to be used that way.
Absolutely, and I think it also goes to, I mean, you're more in the space than I am, but I think it also goes to improving the focus of clinicians because you're giving them time, right? And
right.
I know that for my team, when I'm talking about which AI tools are being integrate where into our process, the highest priority for me is the focus, and second priority is the time. Because you can eliminate a lot of those little things that are floating around in your head, and you become a lot better as a professional.
Absolutely. Are you helping or are you burdening? And that's the difference. If I'm giving things that help my job, save me time, allow me to do more patient care, which is probably why if I'm a nurse, I signed up for this anyway, versus things like charting or other things that it can be handled. Ambient AI, some of the things that are being done are great.
Yeah.
In our environment, it's tell me everything I need to know about this patient. Who are my 5 most acute patients? I mean, let me ask that question. Which nurses have the best record of de-escalating these patients? I should assign them with it. We have all that data, but there's nowhere to go to find it other than, so now we just ask a simple question. Yeah. Tell me, show me. So that's really where I think the value is. And we're seeing great reaction from the nurses and nurse managers that are using our tools and really using our platform, because it's a pretty complex platform. So it's an easy to integrate, but it's pretty complex in terms of how it operates. But we're seeing really great results from the people who really matter, the nurses that are on the front line. So that's That's the audience we want to listen to.
Absolutely, absolutely. So, how do you balance the technology innovation with that patient-centered care? I know it's always a tricky thing to keep
It
track of.
is. Yeah, because maybe humorous observation of technology is we always think we know better and build things and hope, field of dreams, hope people come sometimes. No, I think how do you balance it, particularly in healthcare environment and particularly in clinical environment, is from the ground up. It really is built from the ground up with the collaboration of clinical psychiatrists, nurse teams, whatever, in terms of what are the things they're doing. Think of it in terms of almost like human factors motion studies. What are they doing? What are the things we can do to try to leverage and build that? So I think thoughtfully, and that means not quickly many times because you have to go through those steps and have to ensure that what you're developing will be used. Is it in the workflows? Is it right in the EHR workflows? Because if it's not, nobody's going to go look for it. They don't have time and it'll fail. So how do you build things in that don't, again, burden the staff that needs to use them, but actually speeds things up for them and aids them in what they're trying to do? And if you can do that, then that's how it's built. That's, to me, that's how technology, at least in this environment, needs to be implemented. You need to gain the trust of the people that are using it, and that means you have to collaborate closely with them, which we do, and then they become your biggest advocates, which is the best of all worlds. So it's not only the only way to make it work right, it's a smart way to do it. So
Absolutely,
anyway, so that's my view. It's a ground up thing. You can't come flying in and expect, hey, we can solve something with this great new technology that people don't know about, and in some cases don't trust, rightfully so. So you have to. It's a ground up type of methodology, I think.
absolutely, absolutely. So, I have to ask some of these questions because we are
Sure.
specialists in marketing and advertising. How does your team go about gaining new clients right now? What is working for you all?
It's because we're in the clinical side of behavioral health care, we have a pretty good field of view of who our target audience and client list would be. That said, again, we're taking a message as a clinical message, and we're trying to drive it out to them. So is that better done, documents and print, studies, some of those things you have to do, publish, you have to put out. But one thing we're trying now and I think will be effective is our short video. This first time we're really starting short video clips. Can we send those out? Because what we found is when we've demonstrated Nora, for instance, our natural language agent, we've literally seen people glued to the screen. We've seen nurse managers drop their jaws, roll their eyes. Oh my God, how can we do this? We've never been able to do that before. So if we can capsule that in a video somehow and get it out to people who aren't familiar with what we're doing,
Yeah,
then we hope it will generate that further interest. Because as you know, it's small. And when you're trying to come out, you're trying to really push your message out. This exists now. It hasn't existed before. And we can do these things we've never been able to do before in
yeah,
our clinical operations. And so there's an awareness we need to create. I hope video does that, but I mean, we're not marketing experts. We're trying things, little things here and there to see what kind of reaction we can get. But
absolutely.
that's a primary marketing thing we're trying now. We're just now testing. Literally, we're testing that this week with a
Wow,
group of clients. So
that's
we're
exciting.
we're maybe slow to the party, but we are getting there.
That's awesome. That's awesome. Well, good luck if that's this week's test. Hopefully, it goes well.
I hope so too.
Yeah, that's awesome. Well, thank you so much, Jim. We really appreciate having you on. We appreciate you sharing some of your insights, and I appreciate the work that you're doing. I know the AI innovation in this space is desperately needed. So we thank you.
Tim, thank you. And thank you for your interest in space. And thanks for having us on. I really appreciate it.
Absolutely.